Let's head for Zambia for a second report. In this country located in the heart of southern Africa, herding is one of the main activities of the inhabitants. To face the epidemics which decimate the herds, only one strategy: closely monitoring the health of the animals, even if it means spending part of their income. A report by Peter Yumi and Aurélie Turc.
Generations of smallholder farmers have tended their cattle in the rolling hills of Zambia's southern province. Simon Hilwindi's herd counts 110 animals, a large number by national standards, and today he's showing veterinary assistant Lilian Makosa his herd of cattle. Simon remembers the last serious foot and mouth disease outbreak in the region almost 10 years ago.
By that time I have 70 animals, and out of 70, 30 were dead. By that time, I had lost a lot of money. I had lost 750,000 to control the problems, the diseases.
The equivalent today of hundreds of dollars. Today, he says things are much better. He's benefited from a much improved animal health control system, due in large part to an internationally funded project. Foot and mouth diseases cause economic havoc. Almost 8 million cattle throughout the African continent were infected as recently as 2008. Estimates put the cost of that outbreak at over $15 million.
We struggled for a month. We did minimal production. It was very difficult to just pay wages.
Now, however, thanks in large measure to a 5-year, $20 million plus program, largely funded by the African Development Bank, the disease is much closer to being brought under control. Using digital pen technology, vet Lilian Makosa can alert the regional animal health authorities almost instantly if there's a new case of foot and mouth or any other bovine disease. Paired to a cell phone, the device can provide real-time information.
The reporting system has become very efficient now. Sometimes, if there is an emergency, I might not meet my boss there and then to report the issue. But with this one, wherever he is, he'll get the report.
Not just Zambia, but 4 neighboring countries have also benefited from the ADB's Transboundary Animal Health Project, which aimed to improve not just the health of the region's livestock, but also the nation's cattle exports. All 5 countries have in the past failed to meet several livestock safety standards for such export markets as the European Union. Diseases respect no borders, and an outbreak in one nation can easily spread among herds and wildlife in neighboring countries. Wild buffalo are often carriers of diseases and remain a threat to domestic livestock.
The African Development Bank, through the SADC-TADZA project, has been very instrumental in helping Zambia in a number of ways. One, which top of the list, is a buffalo sampling exercise. The sampling was done, the viruses have been identified, and right now the strains have been identified and they've been profiled, and that information has been alleged to the laboratories that produce vaccines.
The 3-year program to capture and examine the buffalo cost well over $1 million. The Transboundary Animal Disease Project brought neighboring countries' control and surveillance methods into line, and according to Zambian officials, has had a 70% success rate in stamping out the incidence of foot and mouth disease.
There's been the skills transfer from the expertise that came from outside that the bank hired to do the capture. Local people have since been trained in buffalo capture. So the benefit to Zambia is in excess of over $1 million in terms of the money that was spent, but also the human capital that has been recreated by the virtue of the training that was done.
The revenue of farmers doubled. The live stock value chain was secured in terms of job creation and flux of live animals to the abattoirs and to the market, to the suppliers, and also to the consumer. In terms of trade regionally, some indications are about 10 to 15% increase as a result of the intervention of this project.
It's an export market that potentially is worth over $40 million to Zambia. And consumer confidence in the safety and quality of the meat available from abattoirs has also been helped.
We were able to increase production by about 30%. And hence, since we increased production, we were able to move forward, to expand. We were able to open a new processing plant. Gave 60 people new jobs.
120 people now work at the Best Beef Company, and Trevor Kalidis says he's optimistic, so long as the diseases continue to be brought under control. Infected animals also produce substantially less milk. A clean bill of health is good news, therefore, for the St. Mary's Dairy Cooperative in the Monze district in the southwest of Zambia.
After 2 years, we increased 1,500, it was one day. This time, we are getting double. So we opened a new center, as you can see. So this time we are producing 3,000 liters in a day.
The new cooperative was a boon to smallhold farmer Elina Mawinga.
I can get here in just 2 hours now. Before I used to have to travel a day to sell my milk. I make 70% more these days. The extra money means I can pay for schooling and meet any medical bills.
With a handicapped daughter and several other children to care for, Elina says every penny counts. And every dollar has counted as the hunt for vaccines against specific diseases has been pursued in the laboratories as well.
Here I'm just preparing the sample, extracting DNA, manually.
But the samples need to be analysed and the vaccine developed, and here too there was money made available, allowing researchers not only to identify the origins of the disease, but also to speed up the process.
Conventional diagnosis took 3, 4, 5, 1 week, more days to give the results to the farmer, but this molecular diagnosis gives the results to the farmer at a very quick time. So it's very reliable and very good.
Over $500,000 went towards computers, software and the necessary skills training. Jaspin Hibajin is typical of livestock farmers in the Monze district. He owns 40 cattle and spends about 10% of his income, about $25, on having his animals vaccinated. With a growing family, he knows his livelihood depends on the health of his livestock. If his cattle remain free from disease, he'll be able to sell them and reinvest. Jaspin Hibajina, Elina Mawinga and hundreds of other smallhold farmers across southern Africa know the future can never be guaranteed. But with the continuing support of the researchers, the scientists and the veterinarians in the field, their chances of success have never been higher.